Hello and welcome to this panel discussion on the last day of ESPAS's annual conference. I'm Ashley Furlong, a healthcare reporter at Politico. The headline for the conference is Geopolitics is back, and nowhere could that be truer than in global health. The pandemic has thrust the EU's role in pandemic preparedness and global health more broadly into the spotlight. The bloc's successes and failures in this area are no longer of interest only to a small group of global health experts and partner countries. The whole world is now watching. As we emerge from the pandemic, there's much discussion of how Europe can be better prepared for the next health crisis, as well as how it can play a role in ensuring the rest of the world is also better prepared. But we are seeing the realities of competing priorities, such as inflation and war, affect global health budgets. The Global South has also emerged from the pandemic with a very strong sense that it was sidelined and left behind as wealthy Western nations protected their own populations first. The EU now has some convincing to do to prove that it can be a trusted partner. I hope that the discussion today is forward-looking and sets out where some of the key challenges are for the EU as it continues to play a leading role in global health and seeks to cement this through its upcoming global health strategy. With me today, I have a stellar panel to work through these issues. Online, we have Ilona Kickbush, founder and chair of the Global Health Center at the Graduate Institute of International and Development Studies in Geneva. She's also a member of the Global Preparedness Monitoring Board. We have Delia Grace, Professor of Food Safety Systems at the University of Greenwich's Natural Resources Institute. And with me in the room, we have Oksana Dementi, World Health Organization representative to the EU, and Milka Sokolovic, Director General of the European Public Health Alliance. So we definitely don't have a panel as we see too often in global health. I'm very glad that we have such an esteemed group of experts to talk about these issues today. To kick us off, I'm going to be asking each of the panelists an opening question, and they'll have a couple of minutes to respond to that. But I also really want the audience to get involved during this panel. You can use Slido to ask your questions, and the audience in person will also have the chance to ask questions if they so wish. So my first question is to Oksana. The EU is about to publish its global health strategy, and everyone involved in this is really excited to see what it's going to say. We do know that it wants to strengthen health systems and accelerate progress towards the SDGs. Given the lessons that have been learned during the pandemic, what advice is the WHO giving the EU on the strategy? And how can the EU focus its attention where it could actually have the most impact?
Yeah, thank you so much for your question. First, thank you so much for putting health in the agenda of this conference, which is so important. And I think the COVID has revealed that while health is not everything, without health, we have nothing. So thank you for focusing today on the EU role on health and our cooperation on health. And I'm WHO representative to the European Union, and it's my direct role, to promote health in the European agenda and the political, diplomatic agenda, academic agenda. So I thank you very much for this opportunity. And of course, in this role, I cannot miss this opportunity to thank the European Union for great cooperation that we have long-standing cooperation in various areas, but particularly in the last 2 years. So we have worked so intensively together. Of course, we are looking forward also for the new opportunity with upcoming global health strategy. Throughout the pandemic, the European Union has demonstrated a great leadership, also internally by coordinating better internally, but also externally. And I want to commend the European Union for coming together and for making this effort to reinforce internal institutions and making such a bold shift on strengthening their own ability to respond to health security. with stronger institutions, as you know, ECDC, EMA, and we've created new health emergency response authorities, and with new, function and objectives also to help the world, also through this new cross-border threat regulation. And we in WHO believe that stronger European Union and better prepared internally and better united can only benefit the entire world. And this was very, very well demonstrated during the pandemic. And of course, externally, the EU was our key partner during the pandemic. So we worked together to develop new vaccines. And as the President of the Commission said, this didn't come in a vacuum. So it was big effort that European Union has invested in research during the years since 2006, and this was such a good determinant to help develop these vaccines. Then European Union was the biggest exporter of vaccine worldwide. It was our key partner in establishing ACT Accelerator, so the COVAX facility, ACT Accelerator. We have developed together medicines, but we also work with the European Union to help countries to get access to these new tools, also through this new facility, COVAX and ACT Accelerator, but also through other instruments. And we worked with the European Union closely also to deliver these vaccines, also to strengthen health system, not only in humanitarian settings, but also in various settings in less developed countries. Now, with upcoming the EU Global Health Strategy, of course, it's a bit too early to look into the content of this strategy because it's still in making. So we expect to have a communication global health strategy, I think, at the end of November. But we know that the European Commission, the two commissioners, has announced at the beginning of consultation a key priorities, which is accelerating progress toward SDG, and particularly SDG 3, with progress toward UHC and health system strengthening, investing in primary health care, then contributing to global health architecture and global health security through One Health approach. They also promise that the European Union will further focus on digital health and workforce, which is such an important, and also to look at health through all policies, so health determinants, which is very much in line with our WHO priorities that was recently announced by our Director General during the World Health Assembly. And he just launched his vision with key 5 priority, which is promoting health, so investing in root cause of diseases, because we know that health doesn't start in the hospitals. It starts, in schools, in supermarkets, in our communities. So reorienting our health system toward prevention of disease, our public health toward prevention of health, it's very important and has huge potential to save more than 50% of deaths worldwide. So we really push for this, and we're very happy to see that European Union want to focus also on this. Secondly is, of course, to provide health services. And here, when I speak about providing health services, we suggest to the world to reorient health system toward investing more in primary health care, because 90% of essential healthcare services are provided in this area, in primary healthcare services. And we saw during the pandemic that even developed countries that have, very sophisticated health, second and tertiary health systems has developed, they didn't perform so well because their primary healthcare was not so well developed. So the focus toward primary healthcare. is our advice also to the European Union when it comes to accelerating progress toward SDGs. Then, of course, for us, very important, and pandemic has also revealed all the weaknesses in global health security architecture. So better protecting the world against emergency, it's a real priority for us. And during the World Health Assembly, our DG has come with a vision on how this global health architecture should be better strengthened, with better governance, with better financing, with better tool for prevention and response to the pandemic. And we are very happy to see that through EU Global Health Strategy, the European Union is going to play a major role in this global health architecture, to focus also on strengthening WHO, to focus on better funding for health globally, to also to strengthen the tool to detect and prevent health. I don't know, this week we saw, I think, the major progress in Bali, that the head of state of the biggest of G20 has launched the so-called pandemic fund, which we think that will be the game changer in funding for health globally, with a commitment for more than 1.4 billion euro to invest in preparedness, which is far to be enough, because the estimation is that we need around $38 billion globally to be better prepared. But this fund, we see that this fund will be a big game changer, because we can invest this money in HR preparedness for countries, in helping countries also to strengthen their health system where it's needed. So it's really a major change, and the European Union has played a major role, in setting this fund, and almost half of the resources that are committed so far are here. So we are aligned in our priorities. We have been participating in all the consultations, and not only public consultation, we had also private consultation, also based on all priorities. So investing in primary health care and health system resilience, it's very important. Investing in root cause of disease, it has a major impact to accelerate SDG, and of course also powering health through promoting innovation, such as digital, promoting research. This is also, it's something that we suggest the European Union to focus on. And we expect to have, a less fragmented strategy. We expect that all the member states will come in unity, with one voice, with an offer for global health that can benefit the entire world.
Thanks, Oksana. We're going to get to a lot of those issues in just a bit, especially on the new pandemic fund, and I wanted to ask Ilona about that in a bit. But I first want to go back to what you were mentioning about One Health, and I'm going to go to Delia. She's written a lot about this, and written about the frequency and severity of zoonotic diseases such as the COVID pandemic are increasing as we encroach on wildlife habitats and as food production systems intensify. And Delia has also worked on a report with the UN Environment Programme on the deep drivers of disease emergence. And despite having these reports and people in the global health community acknowledging that this is what causes pandemics, there often isn't that much focus on stopping pandemics at their source, and there's more sort of on the response to them when they happen. And Delia, I'm wondering if that's sort of a missed opportunity here.
Yes, I mean, I think it was Benjamin Franklin who said an ounce of prevention is worth a pound of cure. And certainly when it comes to pandemics, we find that when the crisis comes, the international community responds, action is taken, investments are made. It's been a hard struggle with COVID, but a lot has been done. There have been many great achievements in terms of the vaccines, the testing, the increased knowledge around operationalizing One Health. But we don't see the same effort or investment in preventing these pandemics, which could be much more cost effective than responding to them. And what do we mean by preventing them? Actually, we know what we could do with preventing them. We know where pandemics come from. They come from food systems. Most of them originate in wildlife. 3/4 of new diseases spill over from wildlife. But when a new disease becomes a pandemic, requires an intersection with the food system. So either comes through farmed animals, as we saw with mad cow disease, as we saw with bird flu, with Rift Valley fever, or it comes through food-seeking behavior, as we see with Ebola, with HIV/AIDS, and probably with the coronaviruses. So if we want to prevent pandemics, we don't need doctors, we need farmers. We need to go to the food system and de-risk it from farm to fork, along the value chains into the markets. We have the tools for doing that. In farms, this requires something called biosecurity, which is a set of principles and guidelines originally developed to prevent animals getting sick. But when put into place, they can also prevent diseases passing from animals to people. And actually, Europe, it has probably got the most biosecure farms in the world. But when it comes to pandemics, you cannot prevent them locally. You have to prevent them globally. And that is where I think the future attention needs to be paid. Trying to get the biosecurity, the de-risking of food systems, which we've done to a large extent in Europe, to the rest of the world. And this will not only reduce the frequency of pandemics, but it's a win-win because biosecure systems also are more productive and they have healthier, happier animals who produce more food and tackle the problems of food security and reduce the pressure on the environment.
Thanks.
Thank you.
Thanks, Delia. Milka, during the recent session of the Special Committee on COVID-19, the European Public Health Alliance spoke about the need to ensure equitable access to products that are publicly funded, ensuring that there are sort of the right conditions attached to these funding offers. And we also have seen this in sort of the draft of the pandemic treaty that's just recently been leaked. And linked to this is the need for the EU to ensure that equitable access goes beyond its own borders. I'm wondering how you think the global health strategy, as well as the treaty that I just mentioned, can ensure that these ambitions are realized. What sort of concrete language and what concrete commitments do we need to see there?
Thank you, Ashley. Let me first start by saying that I'm here today talking on behalf of people, because the European Public Health Alliance that gathers together more than 80 members from very different areas of public health, representing health professionals, patient groups, but also vulnerable groups, is actually speaking on behalf of people. And from that angle, I would say in concrete terms, there are three angles that we could reflect on. The first is the access that you were also referring to. So we absolutely must acknowledge the massive effort and the substantial funding that the EU and the member states have mobilized to facilitate the development of vaccines, therapies, and diagnostics. However, and there is always a good big however, these calls did not include clauses to guarantee affordability and access to vaccines and therapies. And access conditions should have been included in the advance purchase agreements and should have been used in, or should be used in the HERA, so Health Emergency Preparedness and Response Authority, to enable the downstream access and affordability and the transfer of the know-how, the manufacturing know-how to third parties. And there are examples where this has been used and positively sold, like the Coalition for Epidemic Preparedness Innovation has used these clauses. There is always room for improvement, but there are examples that could guide the work forward. The second aspect to reflect on is the global public goods. The EU and many national leaders promised that COVID vaccines would be treated as global public goods. And this wording was included in the agreement between the Commission and the EU member states and attached to some of the EPAs. However, these commitments did not materialize. And global access to vaccines, and I'm sure we all agree on that now after the pandemic experience, is really crucial for an effective pandemic response. And, you know, we keep saying no one can be safe until we are all safe, but that shouldn't be just a mere phrase. It has to be materialized. And that is also very much in line with the solidarity values of the EU. So this approach should be used in the pandemic treaty, with very clear access commitments for medicines and vaccines, but also technology transfer. And the last angle would actually be the trade. In its 2010 strategy, the EU committed to support the use of the TRIPS flexibilities. And then again, however, the EU's approach to negotiating trade agreements has actually undermined the access to medicines by limiting the use of TRIPS waivers. So going ahead or going forward, it will be crucial for the EU global health strategy to ensure and implement consistency across its all policies, and public health must not be jeopardized by trade policies.
Thanks, Milka. I'm going to go to Ilona now. You know, Ilona, you've been working on global health for many, many years, and you've seen how the political winds have moved it on and off the agenda, I'm sure. And during COVID, we've seen it was firmly front of mind for the EU. Now we're facing multiple crises. A perma-crisis is the word they're using. You know, inflation, war. There's a lot of other priorities, and we're seeing that with recent replenishments that have struggled to reach their full potential. Oksana was talking about the pandemic fund. There were many this year that didn't reach their full asks. How do we ensure that countries continue to invest in global health and ensure that we don't have this even more fragmented landscape with small, tiny little pots of money given to each initiative?
Well, Ashley, it's rather difficult to ensure if you look at the history. The issue is, first of all, we have to keep global health on the global agenda and not fall into this systematic approach of panic and neglect. And of course, what we also see is that practically every of the other crises, the polycrisis, so to say, has health impacts. And therefore, as is being discussed now in COP27, the interface between climate and health, the interface between war and health, one of the key challenges is always to ensure that the health agenda is part of the other agendas. But what we see at the same time as we try to keep health on the agenda, it also leads to a certain amount of fragmentation. We called initially, have health be discussed everywhere, in quotes, but this is getting to be an incredible challenge for countries. We have major health discussions like around the pandemic fund at the G20. We have global health discussions at the G7. We have three actually major UN conferences on health to prepare. Pandemic summit, a high-level meeting on UHC. We have a TB meeting planned. We have very deep negotiations going on a pandemic treaty. We have the IHR revisions, and I'm sure, we could come with a list of others, including the negotiation of council conclusions for global health at during the EU presidency. And there is, as you indicated, a tendency in global health to actually, through all these replenishment processes that happen, to actually become a competitive marketplace. And as other issues take over, a climate fund, for example, financing Ukraine, etc., then money is pulled away if we don't have an insured financing system. And that, I think, is perhaps the thing that we did not get from the G20 negotiations. It was a major step forward to say there will be these regular meetings of health ministers and finance ministers that are absolutely essential. But what we had hoped was that they would look at a mechanism that would ensure the financing of global goods for health. That they did not do. They established yet another, in quotes, replenishment mechanism. And it is, quite disconcerting that even though perhaps, 1.4 billion sounds like a reasonable sum, it is, 10% of what was envisaged for this pandemic fund. So one already sees this circle of panic and neglect working. So I believe we have to have some very serious discussions where we want to center the global health debate and how we get a discussion between health and finance ministers and heads of state that we find a continuous, reliable flow of funding for the global health agenda. And that includes many of the issues that were mentioned by the previous speakers around equitable access. And again, this financing mechanism, which is different from the pandemic fund, has to be looked at in the context of the treaty negotiations. And if I can take that bridge then to the EU Global Health Strategy as one of the major funders of global health, and if you take Team Europe actually as the largest funder of global health, the EU should be using its political clout to actually establish a new type of funding for global health, because also we have all these separate funding mechanisms, but we still are not at the point where we properly fund the one truly inclusive global health organization that we have, and that is the World Health Organization. So the danger of fragmentation, the danger of decoupling, and the danger that because countries don't talk to each other geopolitically, they will also stop talking to each other on health and will not finance global health because they don't come together under that agenda, still looms very large.
Thanks, Ilona. You just touched on something I wanted to ask Oksana about, the funding of the WHO. And we saw a significant commitment earlier this year to shake up how the WHO, how countries contribute to the WHO. And I'm wondering, more can always be done, but I'm wondering with these changes and then with the sort of renewed emphasis as we saw on the G20 Leaders Declaration on the WHO, many mentions of the role that the WHO needs to play in almost every aspect of global health there, which I think was a big kudos really to the WHO and their work that they've done in the last couple of years. I'm wondering, what's this going to change about the WHO's ability to deliver sort of on its mandate?
Yeah, thank you. Thank you so much for this question. It's very important and it's vital for us who are working in WHO. Unfortunately, the attention toward strengthening WHO and adequately financing this organization was not always on the agenda. And this really came during the pandemic. Then expectation was so high, WHO to deliver. But during the so many, expert assessment that has looked into pandemic preparedness and response, it was quite clear that organization was not equipped with the right, tool and funding to respond to a pandemic of such scale. And workforce and health system need resources to deliver their services we in WHO also need resources to deliver our function. But during the year, the funding of WHO was mainly rely on voluntary contributions of the country. So only 80% of our funding comes from assessed contributions, from fixed contributions that we can use, to deliver on our priorities. And all the rest money, they come from voluntary contributions, earmarked contributions, which really doesn't allow us to focus on the priority that we mentioned. And we are very happy that during the World Health Assembly, member state has approved a resolution on better funding of WHO, which actually will foreseen a switch toward better fixed contributions and less voluntary contributions. So this increase from 18, we're expecting an increase from 80% till 50% until 2030. So it will be gradually, and of course it will depend also on the commitment of member states to deliver on these promises. We have also very much grateful to the European Union because Germany, actually German expert and the EU member state has really lead this negotiation on better funding for WHO. We of course understand that we have also a responsibility for better transparency and accountability, and we're also making our internal transformation to deliver more effectively on the priority that also member states together with our secretariat agreed, and to have the sufficient funding for this.
Thanks, Oksana. I'm going to have there's quite a few questions, and there will be some in the room as well. One of them is asking, what are the lessons learned in terms of capability gaps during the COVID-19 pandemic, and is the EU prepared for future pandemics? Obviously, there's been a lot of work already to ensure that the EU is better prepared, but maybe I thought, Delia, we could go from the sort of the aspect that you were talking about earlier, the One Health aspect. What have we seen any significant changes during the pandemic, and as we emerge from it on this area? Is the work that's being done sufficient?
One very significant change is the concept of One Health, which for several decades has been the organizing principle, the gold standard for managing pandemics, antimicrobial resistance, foodborne diseases, all of these diseases which occur at the intersection of animal, human, and environment health, has been acknowledged and recognized by experts and academia as the most and probably the only solution to pandemics. But what we've seen during COVID is this has got traction among the general community, among the development agencies. And now we have the quadripartite with FAO, WHO, World Animal Health Organization and UNET coming together. And really, I think people have acknowledged that One Health is the way forward. Putting it into practice is the challenge. In terms of what we've learned and what can be done, there have been many, many specific detailed recommendations on how we can do things better across covering surveillance, response, health systems, health governance, communication. And I think most of these are good and most of these will be followed. It was a very sharp learning experience, COVID. But I would just draw attention to a couple of things which people aren't talking about so much, but which I think are key to our future security. And both of those have a research focus. I'm a researcher, and of course, it's easy to end every paper with more research is needed. But I do feel that, like in the past 30 years, I've seen many pandemics, mad cow, bird flu, Ebola, COVID still going on. And one thing they have in common is that epidemiologists, like generals, are very well prepared, but well prepared for the last war. And what we are lacking is a science of plagues, a preparedness that takes into account the next plague, not the last plague. For example, many of the failures with COVID management, and they were many and huge, were because what we did was a very effective strategy for the last coronavirus, SARS. So when COVID came along, we sang from the same hymn book, we applied the same dogma, but this time around it didn't work. So I would call for investments in developing a science of plague, which we don't have at the moment. And then, and my last and short but very important comment, I said earlier that pandemics essentially come from food systems, and we need to de-risk and improve our food systems. Well, that was true up to the last couple of years, but now what we're seeing is a potential for pandemics to come out of the laboratory. And some of the research which is going on at the moment is very important, but also very high risk. And we don't have the systems in place yet to de-risk pandemic research. So that would be my second call for something which the EU needs to do, take a lead in and do urgently. Thank you.
Thanks, Delia. A lot of, when we're talking on global health and pandemic preparedness, it's always quite often pretty negative. And I'm wondering, Milka, we've seen a lot of new partnerships and a lot of new collaborations in the past 2 years. And I'm wondering if you're seeing the impact of that beyond pandemic preparedness, beyond responding to the COVID-19 pandemic, if you're seeing it in other areas of health that it's actually having a sort of positive knock-on effect.
Well, definitely. Well, first of all, the learnings from the COVID pandemic are so huge that it would be incredibly short-sighted of us not to apply those learnings outside or beyond the pandemic preparedness. And I would actually like to take the example that Delia was referring to of the not-so-silent pandemic of the AMR, or the antimicrobial resistance. And we already have very high rates of deaths caused or associated with the AMR, and they're affecting definitely not only Europe, but also and actually particularly many of the low and middle income countries. And therefore addressing the AMR in this kind of cooperative and partnership way it will be critical. It requires a huge coordination effort, especially in the actions that will be raising awareness of the AMR and also preventing and addressing its increasing burden worldwide. Just similar to what we were talking about when it comes to the COVID pandemic, the AMR also calls for applying the solidarity principle. And then again, the phrase "no one is safe until we are all safe" also applies here. And in this sense, the European Union needs to lead by example, including in setting the best standards for prudent use of antibiotics in humans and animals. Delia was referring to the food systems, and in that sense, moving to sustainable farming practices in Europe would be a wonderful lead by example. And also it will lead both to health gains and to environmental gains, in line with the true One Health approach. And also there is a need that Europe can fulfill for channeling public funding into supporting innovations to address the AMR, new antibiotics, but also new diagnostic tests and other innovation. And that should also go along with the access requirements that we were talking about when we discussed COVID.
Thanks, Milka. We have a question here that I think would be very good for Ilona to answer. It's someone in the audience who said that they might be happy to ask it. I don't know if there's a mic or if you just should speak.
That question was already addressed by Ilona, but I have another one.
Just hold on. I don't think Ilona can hear you. Is it written in the Slido? Then I will. Great. Is it communicable, non-communicable diseases? Perfect. No worries about there's a mic.
Yes, thank you very much. I have another question also on diseases beyond infectious diseases in the same topic, which is also, I believe, very closely related to the One Health principle. On the rise of non-communicable diseases in Western society and beyond, I'm wondering if this overall trend can be considered systemically and whether it necessitates a holistic approach also through One Health, and on your perspective on that. Thank you.
Ilona, would
Shall
you
I?
like to go? Yes.
Yes. Well, I think there's definitely what I call an integration imperative. And that is, we have learned through COVID-19 the very, very close interface between non-communicable diseases and infectious diseases. And we're also seeing that strategically and systemically, we can't address them separately. And I think there's a whole new big challenge here for public health to overcome the silos in which we've approached those two. There's also an absolute need, and that follows up on Delia, that our primary healthcare concepts are integrated with a One Health concept. We are still not really bringing that together. And that is really also a challenge for how we think primary healthcare and universal health coverage forward. So that to me also seems very critical. But there's something, and right at the beginning we heard that one of the things the Director General of WHO is challenging everyone, and probably the EU Global Health Strategy is challenging, and that is how do we address the root causes and what WHO also now calls the commercial determinants of health. And that is, we must move away from not necessarily always looking at the disease, but going that one step further. And again, that brings the commercial determinants around food together with the kind of agriculture and food challenges that Delia has partly alluded to. So I think we need to do a lot of reshaping how we address key challenges, what kind of strategies we address them with, and how we turn them into a policy priority. Most of all, I think, and again, the EU Global Health Strategy will look at that, and that is the digital transformation of health. The extent to which that relates to issues around taxing major companies, the extent to which that relates to regulating platforms. We're just experiencing a range of things around Twitter, for example. So I think there is a totally new integration imperative, both in the way we think disease, the way we think health systems, and the way we think policies.
Thanks, Ilona. Does anyone else want to come in on this topic? On the panel. Milka, would you like to?
Well, actually, Ilona mentions integration imperative. I think, and it has been also mentioned in the previous panel, we really need a systems change. And that involves our political systems and our economic systems. And we do find ourselves at the point of, I don't know how to call it, it's not poly-crisis, it's omni-crisis, where all the aspects of our lives are at peril, and it can only be addressed with really by kind of systems change, and it will take political will and huge political courage.
Thanks, Milka. Any other questions from the audience? This is your chart. There we go, we have one.
Quick questions about the vaccines production. You stated that, well, there are also some obstacles in sharing vaccines linked also to trade dynamics. And would you consider that these dynamics in terms of IPR protections and all different rules that foreseen in case of global health threat should be, let's say, reconsidered in the name of a solidarity principle that should prevail also the mechanism of a global trade?
Simply, yes.
I see Ilona also nodding. Would you like to come in on that?
Yes, I think we see that particularly the negotiations around a pandemic treaty have very much gone in this direction of equitable access, of revisiting WTO rules and procedures, of revisiting intellectual property. But also the other side of that, and the EU has taken first steps in that direction, is the sharing of technology, helping build production sites in low and middle income countries, and also challenging other key producer countries, think of India, think of China, to support other low and middle income countries in really becoming more self-sufficient in being able to produce vaccines, medicines, therapeutics, and also diagnostics. We always underestimate the role of diagnostics in all of this. So I think the negotiations around the treaty and the zero draft, as Ashley indicated, has started to circulate, and soon we'll all be able to read it, is going to set the tone for exactly the kind of discussion that you've said. But we also see, therefore, these discussions go far beyond only the World Health Organization. It's all about the reform of the World Trade Organization. It's about supply chains, and it takes us back to what, the title of this whole enterprise yesterday and today is, that geopolitics is back. That so much of what we are discussing is linked to geopolitics, is linked to access to knowledge, to medicines, to the kind of things we had not looked at in such detail, or only small groups of people looked at in the context of global health. And that is the challenge that we face and we must take up. And civil society played a major role in putting that on the agenda.
Thanks, Ilona. And if anyone does want to, no time for questions anymore. I'm being told I have to wrap up. I'm sure some of our panelists will be here afterwards. If you do want to read that pandemic treaty draft, we have Politico has the link on the website.
Yeah, there is a zero draft that it was shared with all member states, and we expect at the beginning of December to have the third group of negotiation group and to look into the zero draft we call on this treaty on pandemic. And definitely this issue to be addressed is one of the charter that also the European Union suggested, but also other member states are very supportive to these aspects. And of course, we have seen such a big inequality in distribution of vaccines during the pandemic. This was the biggest painful lesson. And despite all the efforts including of the European Union, also to support ACT-A and to share vaccines, but it was not enough. And we saw recently a published article in Lancet that showed that we could avoid almost a very big number of deaths if we would distribute better vaccines, but the production was not sufficient. And we're happy to see that the first mRNA hub established in South Africa already provided its own batches of vaccines that was shared through other mRNA hub in Africa, and the European Union play really a big role on this. Together, we have a big project with the European Union, also not only to build capacity in manufacturing production, but also to train workforces globally, to build regulatory capacity, which is also very important in Africa. So we are really starting this project, and we think that
Thanks,
this.
Thank you. I want to say a big thank you to our panelists today for your fantastic insights, and to everyone watching online and in the room. Please do stay around. There'll be another panel at 2 p.m. on the future of technology, looking at the key suppliers, new value chains, and disruptive tech. It's clear that it's a key moment for the EU and global health. There's a lot of challenges and also opportunities, and a lot of voices that are wanting to be heard and wanting to be listened to, with some, as our panelists have, fantastic insights. Thank you very much, and thank you for joining us.
Thank you.
Thank you.